Welcome back to my Kegels in Motion series where we're going beyond the squeeze to strengthen your pelvic floor. Real life is in motion and your Kegel training should be as well. This is part 2 of a 3-part series where we're adding our Kegel training into body weight movement. In the first video in this series, I go over how to do a Kegel and why breathing is such a critical piece of this practice. So be sure to check out that video. Link is in the description below to get the most out of today's session. For our movements, you're gonna need a chair, a mat, and a yoga block. If you don't have a yoga block available, feel free to sub in with a pillow or a towel roll or even a small ball for the exercises that we'll be going over. Let's dive in. First, a brief review of our breath and our pelvic floor. So when I cue an inhale, I want you to feel that relaxation of your entire pelvic floor. From your pubic bone, creating space between your sits bones and relaxing all the way back to your tailbone. When I cue you to exhale, I want you to feel the connection and the contraction of that pelvic floor, starting at your tailbone, coming to the space and drawing your sits bones together, and then continuing that contraction all the way up to your pubic bone. I want you to feel these 2 different phases in your body as we go through the exercises in this series. Let's get moving. We're starting in a bridge position. Grab your block or whatever substitute you'll be using and come down on your back. Place that block between your legs. Hands are going to come on your lower abdominals and your lower rib cage. You're going to inhale to expand that belly and expand your pelvic floor between your sits bones. Exhale to press up, feeling that connection of your pelvic floor and your low abdominals throughout that lift. Inhale here at the top to lengthen and expand. Exhale to lower back down to the mat. Keep moving along with me as I bring some awareness to other pieces I want you to notice. Inhale to prepare. Exhale to press up, connecting 50% of your effort around the block. I don't want it to be a Hulk squeeze. I want it just to provide some support of your inner thighs to help you connect deeper with your pelvic floor. Inhale here. Exhale to lower back down. Again, inhale. Exhale to press up. Inhale. Exhale to lower. On your next lift, notice your rib cage. Inhale, exhale. Be sure that it's not arching, but rather staying connected with your pelvis. That helps improve your pelvic floor connection. Inhale here, exhale. Again, inhale, exhale. Pressing through your whole foot, not just your heel, to help connect deeper into your hip muscles, which also helps support your pelvic floor connection. Inhale here, exhale to lower back down. One last time, inhale, exhale, inhale, exhale. Next, we're going to transition onto our hands and knees for our bird dog exercise. Take your yoga block and place it on your back to help you know where your spine is in space while we move. You're going to inhale to expand your pelvic floor and low abdominals. Exhale to connect your pelvic floor and low abdominals. Inhale here to expand. Exhale to bring the limbs back in. Again, inhale to prepare. Exhale. Inhale. Exhale. Inhale here. Exhale to reach. Checking in that your head is staying in line with your spine, not dropping down. Inhale here. Exhale to come back in. Again, inhale. Exhale. Again, inhale, exhale. One last time, inhale, exhale. Checking in that our spine is staying long. Inhale. Exhale to bring it back in. Now we'll transition to the other side. You're going to inhale again to expand through the sits bones and the low abdominals. Exhale to contract and connect as you reach long. Inhale here. Exhale to come back in. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Checking in that you're staying in midline with your spine, not leaning off to the side. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Last one. Inhale. Exhale. Inhale. Exhale. Next, we'll transition up into a seated position. Finally, we're going to be going over a squat from a chair with our block. So take your seated position. Place your block between your legs, and you're going to walk your feet a little bit back behind you. Again, we're going to think about that inhale to expand our low abdominals and also to expand our pelvic floor down into the chair. You're going to exhale to connect your low abdominals, connect your pelvic floor as you breathe out to stand tall. Inhale here to expand. Exhale to lower back down to the chair with control. Again, inhale to expand. Exhale to stand up tall. Continue to move with me as I bring some other awareness that I want you to notice in your body. As you inhale here, exhale, connect that pelvic floor, hinge as you slowly lower back down to the chair. Maintain that 45-degree angle so you can really take advantage of your glutes to also help with that pelvic floor connection. Inhale, exhale. We want that 50% squeeze around that block as we stand and also as we sit back down. Inhale, exhale, come back down. Again, inhale, exhale, inhale, exhale. Finally, notice your feet. I want them to ground fully into the floor as you inhale, exhale, press through your full foot to help to connect the hip muscles to help your pelvic floor. Inhale, exhale, to come all the way back down to your chair. I hope this series was a helpful challenge for your brain and your pelvic floor. If it felt that way, you're likely doing it correctly. Remember, the goal of our Kegel training is to connect our brain, our breath, and our pelvic floor into our movements so that with practice, that becomes an automatic response. Most of my patients find a noticeable improvement in this ability in approximately 2 to 4 weeks of daily practice with these exercises. Once that feels true for you in your body, you are ready for part 3 of this series where we're going to be adding weights to our movements to further strengthen that pelvic floor. I look forward to seeing you there.